So this is the latest supplement that I'm using that's very effective for Lyme and the co-infections. Now, as you all know, the end stage in Lyme disease can be augmented by using many other modalities, energy, supplements, herbs, and I'd like to mention a few of these. Herbs have been used by many, many people for many years. For Lyme, the standard one is the Buna protocol. Andrographis is a Chinese herb, it's the main one. Cat's claw and Japanese knotweed, that's called the Buna protocol. It's fairly effective, but herbs alone are not enough to heal chronic Lyme. They speed it up. They cause Herxheimer's like all the other things, but they're part of the armamentarium in many different protocols. I have to tell you that the Cowden protocol, which you might have heard, is pretty much impractical. 21 rotating herbs. It doesn't get you to the end. You have to add other things to it. It's possible to use that, but most people don't. It's expensive. It's complicated. There are other herbs you can use by specialized practitioners. And one of the problems with Lyme disease, since there's so little standard research in the holistic approach to Lyme disease, if you look at 100 different practitioners, they're doing 100 different things. And this is true for everybody in the Lyme field. It doesn't mean they're wrong, it doesn't mean they're ineffective, but everybody has a different approach because there are so many options available. And a lot of this depends on availability in the local area, finances, and so forth. One of the best things that have been used for many, many years is the Rife machine. Does anybody use the Rife machine here? Okay, so you know what it is. It's an ELF frequency electromagnetic radiator. It was invented in 1935 by Royal Rife, who documented with the Southern California Medical Society 14 out of 16 cases of advanced cancer healed with 3 months treatment of Rife. The president of the AMA at that time became victimized by it, and he had the federal government, along with the drug companies, pass a federal law saying this is illegal for doctors to advertise it and to charge for it. But still, there are many companies that make it. The two main companies that we use, one is $200. It's called Spooky 2 from New Zealand. The advantage of this is that there's a biofeedback component to it, which is very accurate, can tell you what are the co-infections and other diseases you have, and it's fairly reliable. The other one is called Digital Rife, which is about $700. Very small, simple, very easy to program. With Rife machines, you have to program every diagnosis, including the co-infections, candida, and this and that. And you have to do it 6 out of 7 days a week. You work up to it. It produces its own Herxheimer's that are not as severe as others, but it can be very good, shorten the course, and be effective. I have some patients that swear by it that are using this alone for 6 months or a year, year and a half, and they're getting good results. They haven't been tested to see whether it's cleared, but it certainly is a worthwhile designation. The second very, very effective method is ozone. Has anybody used ozone here for Lyme disease? Well, it's characteristic. People in this part of the country aren't into ozone, but out west and the rest of the world, it's very big. There are ozone bars. For a half an hour, you can get a steam sauna treatment, oxygen. Ozone has been used for 60 years. It's very, very effective. It's the single best anti-aging modality available. It kills all microbes, kills cancer cells. It's part of cancer holistic clinics. It stimulates energy in the mitochondria, detoxes your cardiovascular system, and does many, many other things. Stimulates the immune system. What single agent can do more of this? I don't know. The practical way to do it is to do it at home, buy the equipment, which isn't too expensive, about $500. The simplest way is rectal insufflation. Takes about 3 or 4 minutes a day. You start low and work up to every day, and it can produce its own Herxheimer's. It's very, very simple. They say 1 in 10,000 have side effects. I've never seen a side effect. I've never spoken to anybody that knows what the side effects are. So it's virtually totally natural, okay? If you use the regulated dose at 35 parts per million, it's totally non-toxic. The second way is a steam sauna suit or a tent. You have to buy a little bigger equipment for this, and you sit in it for a half an hour with moist, warm skin which absorbs ozone, distributes through the blood-brain barrier, and affects every organ in the body. So ozone is very, very good because it can shorten the course and really result in a long-term healing. It itself is not enough. I've had patients tell me after 1 or 2 treatments that their arthritis and their neuropathy have abated. So it can be very, very good. I used ozone myself just as a natural treatment, just for the heck of it. And after 2 weeks, I didn't have pain in my body, and my energy was so great, I couldn't get tired working out or hiking or biking. So I know it's very, very good and reliable. A lot of people don't like it because they think the mechanical equipment is too complicated, and it's not. It's very, very simple, but it's been around, and there are ozone conferences all over the world. It's very reliable. Intravenous ozone is given in many places, but you have to go very frequently to the office for that. And the other methods of applying it are just as effective. So we have ozone, Rife machines. Do we have any other energy machines? Something called a biocharger. Does anybody know what that is? Okay. They're very expensive. They're many times more powerful than the Rife machine. They consist of a Tesla electrostatic coil which irradiates noble gas tubes around them. I had a friend coming in from San Francisco that built his own according to the original specs, and we treated 50 Lyme patients with it. 2 3-minute treatments, 2 weeks apart, and 46 out of 49 became asymptomatic with that. They weren't cured. We did CD57s on about 10 of them, which showed they had a little while to go, but they became asymptomatic with 6 minutes of treatment. Now the company makes theirs much weaker because with this we found some patients that develop 1 and 2 month Herxheimer reactions, and they don't want to be under the gun by the FDA or lawyers to get sued for Herxheimer reactions, so they made them much less reliable, much less powerful. He was also using muscle testing to test which of the noble gas tubes that were possible with each patient, testing for the co-infections as well as subliminal co-infections. And let me tell you a little about what are called the subliminal co-infections, not the Babesia, Bartonella, or Ehrlichia. These are infections in the gut that are silent, that everybody has, 6 or 8 of them. Viruses, bacteria, parasites, and you name it, they're there. They're not active, they're not causing any damage, but when you get another intervening disease, especially when you're older and weaker, they can become active and result in clinical symptoms such as EB virus, mycoplasma, herpes, on and on, parasites, even gonorrhea, syphilis, tuberculosis. They're all there and silent. And the various names for these phagocytic, saprophytic organisms, non-invasive infections, everybody carries these. And these have to be taken in consideration also when somebody's sick with chronic Lyme disease. So the biocharger can be very, very effective. It fortunately does not produce much in the way of Herxheimer's. So it's very, very good. You have to go once a week for a year or 2, but it can really shorten the course, and it too has to be programmed for every co-infection. There's also something called hyperbaric chambers. Does anybody use these? Every hospital has an outpatient hyperbaric chamber. They use it for, insurance companies will pay for burns, post-op infections, but they can be used for cancer as well as a whole host of other chronic infections and other diseases. They're wonderful, but unfortunately they're very expensive. I only know 2 in eastern Massachusetts that are available to the public. If you have Lyme disease, the outpatient departments of hospitals will not recognize this as not only reimbursable, but usable indication for hyperbaric chamber. It usually takes an hour of treatment. You lie in a big tube, or you can sit up in a booth, and usually it's 1.4 atmospheres, some are 1.8, 2.0, and they can be very effective. People get results immediately from this in terms of energy. As you know, most microorganisms have anaerobic glycolysis for their metabolism, so this shuts that off and empowers your body's energy system, especially the mitochondria. So we've talked about Rife machines, hyperbaric chambers, Orasal, Lymeplex Plus, herbs, and We should say a word about Herxheimer reactions. Almost everybody probably has experienced a Herxheimer reaction. Has anybody experienced that here? Okay. With antibiotics, Orasal, Lymeplex Plus, almost everybody develops Herxheimer's. It's pretty straightforward managing these. If it's serious, and the very young and the very old usually have heavy Herxheimer's, 5 to 10% of the population we call poor metabolizers or accumulators. They genetically don't have enough of the right enzymes in the pathways of the liver to detox. They can get much more serious Herxes. If it's a significant Herx, we stop all treatment causing it. In the literature, you can find 15 supplements that you can use. Believe me, none of them work because the immune system is about 30% of the weight of the body. You can't turn it off with a few herbs. You have to stop what's causing it. So we stop it, or we reduce the dose significantly to half dose, and then we restart it after the Herx is over. We call it a Herx. Usually starts within a week or two of treatment. Usually lasts